Hello, my name is Megan Whitaker, and I've never really done this before. I'm trying to work on a project for my university studies for my master's degree, and we made a pamphlet, and I'm going to try to attach my sound to my pamphlet about wound culture collection, tissue culture collection, and bone culture collection. This is very important in the hospital whenever personally I'm actually focusing on when they're collected, like in surgery, post surgery, or maybe a wound prior to surgery, so that they can see what's going on. So like a tissue culture, it's mainly organ, tissue, cell culture. They do those to see if something, whenever they cut you open, they might remove your appendix. So then they're going to sit there and they're going to culture it to see what bacteria was growing, so that they can make sure that if an infection starts, that they can get treatment for the infection that will cure the infection. Surgical site infections can sometimes be superficial infections involving only the skin. The CDC also, talks about how they're more serious and can involve tissues under the skin. It can affect, if you have any type of implants, like a pacemaker, it can affect your organs. After surgery, you would have redness, possible swelling or drainage from the site. It might be discolored. If you have a wound after you've had surgery, apparently they classify this in 4 different classifications, and it's called, the abbreviation for it's the NHSN application. I don't really know a lot about that yet, but the 4 classifications are clean, contaminated, and dirty or infected. And surgical site infections, it can cause delayed healing. You could get a really bad fever, pain, tenderness, warmth. It could, like I said, it could cause swelling, or, your skin to be raised up. If the infection moves into your bloodstream, you could become septic, and then that's definitely life-threatening. And honestly, any type of wound, not knowing the bacteria that's causing the wound or the surgical site infection, anything could be life-threatening, because you don't know when you first start having the issues how long it's going to take and how hard it's going to be to isolate the source of the infection and get the treatment and the antibiotics that you need so that you can recover. Some people get chronic wound infections, and their tissue could start to become like necrotic. People that are diabetics, I've heard, they can get infections for their lower extremities and toes, and I've heard of, their toes getting necrotic and having to be removed. Or if there is tissue, they can do like a debridement and try to get the infected tissue out and save the rest of the tissue. And then, you could involve skin grafts and anything to, when they get what they call positive result for a culture, the bacteria or organisms in the wound are infected, and they have to find the best antibody to treat it. A skin or wound culture is to find the germs for the bacteria, virus, or fungus that's causing the infection. And whenever you have this going on, your healthcare professional uses a special swab to collect the sample. And if there's drainage, and they can get it like an aspirate of pus, sometimes that's less invasive, less traumatic, and actually a better source to be able to get cultured so that they can isolate the bacteria that's making you sick. The bacteria, whenever they culture it, some bacteria on your skin is normal flora, and the culture, they would have to also, when they do the culture, separate the normal skin flora from the harmful bacteria that's making you sick. So that's got to be isolated. Most hospitals, I have also just briefly in my pamphlet mentioned antibiotic stewardship, and that's an effort to measure and improve how antibiotics are prescribed, so that we can be effective in treating infection, protect our patients from harm, and cause unnecessary extra use of antibiotics when we don't need antibiotics. Because if it's a virus versus a bacteria, you may not need antibiotics. But, bacterial infection, you can't let it get too far along, because if the patient becomes septic, you could lose consciousness, have trouble breathing, get a very high temperature, you could get confused and clammy, pale, slurred speech, all kinds of issues, to where people could even misinterpret your symptoms as something like a stroke or something else going on. So whenever you're in the hospital after surgery, it's really important for them to have collected the surgical samples properly, so that when you're in your room healing, like maybe after a hip surgery, they're waiting until the wound gets healed some and do a little bit of therapy and get you up. But if you start having disorientation and fever or confusion, they need to figure out, especially with heart rhythms, and if your blood pressure goes up, if you're having a stroke, if you could be getting septic, if you could have caught something while you're in the hospital, and that's called a nosocomial infection, or if you picked up a virus while you're in the hospital, and along with your surgery, now you're healing, but you might have picked up the flu or COVID, and they need to make you comfortable and isolate you and get you the treatment you need. So there's so many different factors that go into making sure the wounds are treated, the samples are collected, and they get to microbiology in a prompt manner, because you don't want any delay getting those samples to micro to be set up, because it could interfere with cultivating the bacteria, especially anaerobes. Anaerobic cultures, from if they had you cut open and they were dealing with an appendix or an organ, it might be growing a bacteria that dies once it hits air, and we need to get that cultured. It needs to be collected in a special tube. Sometimes at the bottom of the tube or swab, there'll be an ampule that gets first to keep that anaerobic environment till it makes it to micro to get cultured, and they're good for so many hours. And then once it's cultured, they also put it in a special jar before it goes in the incubator to keep that CO2 level in the air rather than a hot oxygen content. So the most important thing is, if you're a healthcare provider, please take collecting samples, especially surgical samples, seriously, because your patient, you're the only one fighting for them and trying to get them better. And if you don't take collecting these samples seriously, there are so many things that get delayed, so many other things that can happen to your patient, unnecessary treatment, unnecessary antibiotics. Then you got the side effects of antibiotics, and with excessive antibiotic use, they might get C. diff, and then that causes them to be in the hospital in isolation even longer, till they have so many negative results before they can be released back to a nursing home or wherever they came from. And just take it seriously. I know you might not work in microbiology, but do it. Be a team member, and we take it seriously. We don't understand what you do in surgery. We're just asking you to take the time to read the pamphlet or read something that's posted about how to collect the samples for us, so that we can get everything done in a timely manner, so our patients together, we can, help them get better and get back home and not have an extended stay due to something as simple as just spending an extra few seconds taking the time to make sure that, it's a sterile site and that things are collected properly and it's not a contaminated site, so that where, if it's contaminated and they treat off that's unnecessary. That's unnecessary antibiotics, and it's just going to cause your patient more issues. All right, well, I'm about out of time because I'm getting ready to leave work and I need to get this posted. And I just wanted to get on here and educate anyone I could with the information that I have. So thank you for listening. I hope you have a great night. Bye.